Yes. So I'm Chris Cooney. It's my pleasure to welcome you to our 28th week of COVID resource and recovery calls. As I indicated in the chat, we have quite a bit of new information, and we're going to get into it in a minute. I just wanted to acknowledge our partners in promoting these calls: Avon Industrial Park, Bridgewater Business Association, the Brockton Area NAACP, the Campello Business Association, the Cape Verdean Association, Eastern Chamber of Commerce, the East Bridgewater Business Association, the Haitians United, the Massachusetts Small Business Development Centers, the Norwell Chamber, the Pembroke Chamber, Randolph Chamber, the South Shore Women's Business Network, and the Stoughton Chamber of Commerce. These calls are being recorded, and we encourage everyone to post questions in the chat or the Q&A section, and our panelists will answer them as we go. As I said, we have a lot of new information, as well as a featured guest with us. Lisa Field joins us, and she will bat cleanup, as they say, and provide some additional information. She is co-chairing a task force that was appointed by the mayor of Brockton, and perhaps he might share a little bit on that too. So why don't we get right into the matter, and we'll lead off with you, Mayor. Good seeing you again this week. How are you?
Good to see you. Yeah, 28 weeks. Imagine that. Margaret, Susan, Chris, myself, 28 weeks. It goes by quick, but I want to thank Metro South Chamber and Chris for your leadership. And, Lisa Field from Mass Nurses is just unbelievable. She helped us just yesterday with a roundtable for businesses. And we got to talk about COVID, of course. We're red classification. 63 municipalities in the Commonwealth have been elevated. Right now, we've lost 294 loss of life, 294 deaths, 191 active current cases here in the city of Brockton. And our total number, unfortunately, is hovering at 5,000. We're at 4,996 right now, and I'm sure at the end of the day, we'll be over 5,000. So I had a call today with the Signature Healthcare folks and Good Samaritan folks and Neighborhood Health Center, and it's all hands on deck right now. And so Lisa and many other people have volunteered their time to be members of the Mayor's Health Equity Task Force, and we're working diligently. And she'll talk about the roundtable yesterday, but it was extremely important, informative, and Dr. Rick Herman, the city's medical consultant, participated with the metrics and the data. So, the fact that people are dying, people are getting sick, we have to be diligent and vigilant on this, and we control our own destiny. So I'll let Lisa talk about that, but I do also want to take a moment. I hope everybody was able to either read online or pick up the Boston Globe yesterday. Two unbelievable articles about the city of Brockton. One of the titles was "Brockton Offers a Gateway to a New Generation," and the other one was about the many tasty restaurants and businesses that have popped up here in the city of Brockton. So Lieutenant Governor Polito reached out. She was very impressed by those two articles, and it was a good day, and I will continue those efforts. So I just want to thank everybody for everybody working together in collaboration. That's the key. And also everybody that helped on the census. It closed yesterday. Total number in the city of Brockton, 60.5%. So we're better than a lot of other cities in the Commonwealth. We made huge grounds. And again, I want to thank everybody that participated in the federal census. It's going to reap financial rewards for the city.
Thank you, Mayor. Thank you for mentioning the Boston Globe article. I had a chance to speak with the two reporters a couple weeks ago, and I said, as much as I can say good things about Brockton, and I have for years, I want you to talk to the business people. And so I was delighted that Nelson was able to connect with them, provided them a number of contacts in a number of industries. And my understanding is that they're going to do another one. They have a bunch of manufacturers who they're talking with now, and that we're going to hear a little bit more about why manufacturers have chosen to stay and grow in the city of Brockton. And of course, we've got some great manufacturers here in the city that employ a lot of Brocktonians. And they run the gamut from the old shoe industry, now that's boating industry, to food and innovative food and exciting food, including smoked fish and that type of thing that people wouldn't necessarily think of Brockton, in terms of fish, because we're not a waterfront property, but we're essential to the market, and we're essential to getting that fish packaged, smoked, and shipped out to the population all over New England. In that particular sense, smoked fish goes all over the world. It's a really extraordinary product. But beyond that, I was just talking to somebody the other day, and they said they were up in Vermont and they picked up apple crisp because they were picking apples. And they said, "Did you know that that was made in Brockton?" And I said, "Yeah, of course I do. That's Concord Foods." I said, "Did you notice the banana bread right next door and in the aisle?" And they said, no. And so, our name, Cindy's Kitchen, same thing, really high-end grocery stores have all of our dressings and that type of thing from Brockton. And so it's great to see those companies doing well. And it's great to see the Boston Globe noticing them, and wanting to highlight them. So that's great. Thank you. And of course, we all need to stay vigilant. We see what's going on. I saw the quotes from Chris Christie today saying, this is serious. He was in the ICU for 7 days. He said, put on a mask, wear a mask, keep it on, and avoid what I had to just go through. And so that's enough to scare me. I mean, it reminds me every now and then, you might not wear your mask as much, or you say hi to somebody, and you just know that you really need to prevent from getting it and giving it to somebody else too. So thank you for that update, Mayor. I was on the call yesterday too with Lisa, and she did a great job. In fact, we asked for the recording so we could post it on the COVID recovery page at www.metrosouthchamber.com. So we'll post that there as well. And there was some great news too about worker employee tax credits. And I think we're going to hear a little bit about that for employees who are afraid to call in sick and lose wages. There's a program now that they were talking about yesterday that will give credits back to the employer to pay them those 2 weeks that they're out quarantining. So we'll hear more about that in a minute. So thank you very much. So I'm going to move right on to Margaret. Margaret, I understand you have some items, some screen shots you want to share of some slides, and that kind of highlights some new information from the state. So.
Yeah. Can you see that okay?
Yes, that looks great.
Okay. I just need to, yep, there we go, from the beginning.
Well, it doesn't look great, but it's
yeah, it's coming. It's coming. It takes a minute because you can't, if you preload it on your first slide, it doesn't let you slide through. It's a little tech glitch. But I just need to start with saying, Sue and I have had the privilege with you, Mayor, and Chris to tour a few of the Brockton manufacturers. And really some of the best incentives that we can offer are in the Commonwealth are manufacturers and gateway cities, and you guys really hit all the boxes. Your planning director likes to call it the 7-layer dip because there's just layers of incentives. And Brockton, Brockton's open for business. You really put good packages together, and we're happy to work with any manufacturers on that. There's some really great incentive programs we can talk about for them. So let's talk about what we're here for today, and that is where we are in the reopening process. So 65 municipalities are in the red. This is the weekly health report that DPH issues on Wednesday. So you recently heard about this in the news, and it can show you, which communities are in the red. So red communities are in step 1. Other communities are in step 2 if they opted to do that. Our travel advisory, as you know, the governor issued if you're traveling outside of Massachusetts to a lower risk state. So you see in New England, we're doing really well with Maine, New Hampshire, Vermont, New York, and Connecticut. And those are the lower risk states. But if you're traveling to the red states, it requires the quarantine or the negative test results when you return. So just kind of giving you the perspective about how well we are doing in Massachusetts versus the country, just that information is always being updated on, and I have the website here. And this last week, I think on Monday, we announced the Eviction Diversion Initiative. We've talked on this call quite a few times about the eviction moratorium, and the Massachusetts eviction moratorium expires tomorrow. And there is a federal moratorium that stays in through the end of the year. Whether that's going to be extended, I'm not sure, but the Baker-Polito administration has funded some eviction diversion initiatives. And so I know that the RAFT program that we're hearing much about, and this is normally $4,000. So if this is emergency rental mortgage assistance, normally is a $4,000 rate. They're increasing it to $10,000 per household. And I believe for Brockton, it's right. So really, you want to call I'm going to direct you to the 211 line to call for more information, but I think it's fair to say that NeighborWorks has such a strong presence in your community, and I believe they administer your local raft dollars. I know they do, so, right, okay. But I'd go through the system, but if anyone is looking for that assistance, really, the resources are there. I know it's hard to make a phone call and be asking for help, but mortgage and rental, and this is residential, it is not commercial, whether there's going to be any commercial mortgage rent assistance, the SBA programs, whether something else comes out federally, it's something that's definitely trending. I don't have any announcements around that today, but these are some of the resources. We have some great programs we have in place that are being additionally funded to help with housing assistance. So
we've talked a lot about that, Margaret, about the 4,000. That's brand new information, $10,000 now. So people who have qualified and received maybe the 4,000 to pay a couple of months of mortgage could possibly go back, you're saying, and get some more assistance.
Correct.
So that's huge. And we're asking landlords to pass that information on to their tenants. A lot of times they're not aware of it, and then
if you're
employers, post it on your bulletin board in your cafeteria. Let people know that this is available and that folks should apply right here in Brockton. It's NeighborWorks.
And I just want to, some of the landlords, if you're a small landlord, so if you're a property owner and you're on this call, the landlords can apply for the assistance if you own only small amount of property. So not the big, the big high density housing, but some of the smaller, you own a few units here and there, there's ways. So we can work with you on that. But
you're saying that the landlord who owns a 2 or 3 family anywhere in the region or the state can apply for their tenant?
There's a way that they can do that, yes.
Okay. Wow. That's new information.
Or they can submit. Yeah. I don't have the nitty gritty on it, but there's a mechanism in place. And so getting this information out, right, is really important, especially where you have such a great partner in your area.
Well, the average rent in Brockton might be in the $1,600 range. So that 10,000 could take you 4 or 5 months to get to. So that's big for our landlords as well, because they're paying taxes in the city, paying real estate, water bills, and all that. And they may have a 3 family, but maybe one of the 3 isn't paying. So that's great information. And I believe Emma just posted the resource down below. So thank you. I didn't know if there was more.
Oh, no, that's it. Sorry, that was the last of the slide deck. I know Sue's going to share our time with an update on some information on the budget as well.
All right, great. Thanks so much, Mark.
Money's the topic this week.
Yeah. Thanks, Margaret. Yeah, so this Wednesday, as you may know, the governor unveiled a $45.5 billion revised budget for fiscal year 2021. And that the good news is that does not increase taxes on, struggling businesses and individuals. So a lot of this increase is based on the fact that we're not going to be getting some revenue that was anticipated originally due to the COVID-19 pandemic, as well as an increased caseload costs with Mass Health also related to COVID-19. So what's really important on this call is that there's a commitment for $100.7 million in new funds for small business recovery programs. That would also invest $35 million in small business grants that are targeted towards minority, women, and veteran-owned businesses, as well as $35 million for community financial institutions and $15 million for small business capital improvements. And that includes business technical assistance as well. So hopefully we'll be getting some more information on that if and when that goes through, but I wanted to give you the latest and greatest on that. And then as the holidays coming up, we also wanted to share some tips for the upcoming holiday for Halloween and how to stay safe for Halloween and be healthy. So some of the things that we're seeing from the U.S. Center for Disease Control and Prevention are to enjoy Halloween outdoors instead of having your activities inside. And then placing your candy on a platter or a cookie sheet instead of in a bowl. And then also maybe including next to the candy, a little jar of hand sanitizer as well. Consider leaving that up there too. And then instead of having people knock on your door for the candy, leaving it outside instead. So to encourage people to keep a safe distance from others. And then as far as the face coverings are going, make sure you wear a face covering. And then a costume mask isn't really considered a suitable face covering. So you can wear an actual mask, or you can wear a mask under your costume mask. But to be sure you're making that, being protective of yourself as well as others. And ensuring that you're keeping that 6 feet of social distance for anyone that you're participating with. And then the other thing to consider would be some new maybe traditions with your household. So things like hosting a Halloween virtual costume contest, or pumpkin carving contest, or having a Halloween themed movie night, or a scavenger hunt, making a Halloween themed meal, decorating your yard, those kinds of things. So really, we're just trying to encourage people to stay away from going to haunted houses where there's going to be lots of people in tightly together screaming, going on hay rides or tractor rides where you're in with other people who aren't in your household, and those kinds of things. So, and again, if you're not feeling well, by all means, keep your distance. So that's it, and hope everyone has a healthy Halloween, but we should probably be on a call before then, but just wanted to put those ideas out there for you.
Thank you, Susan. That was a bright of sunshine in the middle of this. And a reminder that we have to laugh and we still have to live, but be careful doing so.
Right.
So that's great update. And that's new information about the budget. I had heard it on NPR the other day, but I hadn't really seen the items. Do you know is that available now for people to scroll through and see how much is in each line item?
Yeah, I can send some information to you that gives a nice breakout of kind of all those different buckets.
Is that a link that could be put?
Yeah, I can send it in your link. Sure.
It's amazing what the state does now, that you can actually look at line item by line item. It's really amazing. So thank you for that. We'll put that down below if you're interested in looking at that. Also want to thank Margaret and Susan for helping us secure the Secretary of Labor, Rosalind Acosta. She's going to be with us on Tuesday, along with Mayor Sullivan and Sheila Sullivan Jardim, who will be interviewed right away and talk a little bit about the local issues with workforce training and the resources available. And then the mayor's going to kind of give a bigger scope of what's happening and his vision, and kind of hopefully going to highlight the Boston Globe article and a few other things for the secretary. And then she's going to talk about some of the questions people are getting, like how much money is left in unemployment, and will there be a stimulus, and if there's not, will the state do something else, and is there anything in the $45 billion budget for people who are out of work, who for no fault of their own are now struggling. So we're looking forward to that presentation. We hope all the folks that are on today will tune in. That's Tuesday the 20th at 12:15. So thank you for your help in securing her. So now I see Eli is with us. Eli, how are you? Welcome. And you've got some good news too from what we were talking about earlier this week about PPP.
Absolutely, Chris. It's great to be here with you again. And, thanks for the opportunity to provide an update on the SBA front. So October has been, so far, has been a month full of updates for us. So we started with a new SOP for our lenders. We provided our lenders with the change of ownership notice, lender notice when there is a PPP in the mix between the buyer and the seller, and steps for them to follow if that's the case. So it's definitely provided a lot of clarity to a subject which has been a little controversial during the 6 months of the PPP loan program, and all these transactions that are involving changes of ownership, mergers, acquisitions, and what have you not. So in addition, last week, as you probably all know, we did receive a further streamlined a loan forgiveness application for the Paycheck Protection Loan Program. So Form 3508S for simple was introduced by the SBA and the Treasury. So it's not the action we were hoping and anticipating from Congress with that blanket forgiveness of a certain dollar amount, which keeps changing, every week now, depending on which way the wind blows. But this one is in place. It was announced last week. It's for all loans of $50,000 or less. So it's not mandated by Congress. It's not the legislation has not been changed or amended in any way. This is directly from the agency, and it's welcome news for a lot of our lenders and small businesses.
Yeah,
So
I'm sorry. I was just going to ask
so
what percentage is that? There are a lot of percentage of 50,000 less.
So absolutely, it's a very good question, because out of the 5.2 million loans, right, number of loans we approved during the the various rounds of funding, 3.57 million by units are for $50,000 or less. So 68%.
Wow.
Right. So
Can't do that
for
math.
most of our local Massachusetts. Right. So for our local lenders, it represents well over 60% of their portfolio. And it makes life easier, basically, right, for the lenders as well as for small business owners. So loans under $50,000, again, combined nationally account for less than 13% of the total dollars. So that's why it was a decision that the agency put in place. But as you can see by the numbers, right, by units, it's a lot of work. It's a lot of work for our lenders. So two things to keep in mind is that loans under $50,000 that apply using simplified Form 3508S are not subject to any FTE, full-time equivalent reductions, or wage and salary reductions for the employees. So unlike the easy form, which has to meet certain criteria, right? So no reduction on wages and hourly wages and salaries, and no reductions, on the number of FTEs, whether because, small businesses couldn't hire similarly skilled individuals, or because they were not fully operational and operating at full capacity because of, CDC guidance and state regulations. The simplified version of that streamlined process does not ask any of those questions. If the loan is $50,000 or less, no matter what happens, right, it's not subject to any of the reductions in place by the CARES Act. So major benefit for small businesses there.
That's great.
Of those, yeah. So of those, approximately 61 million or so units, right? Close to 2 million are for small businesses with absolutely no employees. So the majority, again, is small businesses with employees, and obviously that's the whole goal of the program, right? To make sure that this money gets 100% forgiven. And speaking of forgiveness, we did start making payments to our lending partners. So on October 2nd, first payments for loan forgiveness were issued. So as you know, PPP loans are private loans funded, from the various lenders that carry a 100% guarantee by the SBA. So these lenders who received applications from their borrowers, they submitted for forgiveness, and we're starting to make payments on the good majority, of those decisions already submitted. So I'll highly encourage the lenders, the borrowers, to, if they've, used up all the funds, if they're close to the end of the covered period, or have met all requirements under the CARES Act or qualify for the 3508S, to submit their loan forgiveness application. For the lenders, if any on the line today, the simplified version of the loan forgiveness application will go live on Monday. So it's going to be on the portal. It should be ready to go as early as Monday, the 19th. So we're excited about it. I think, in the absence of major legislation, I think this is the best next thing we could hope for. So.
I agree. That's huge for our smaller companies that have received 68% of companies that received a PPP received $50,000 or less, and the forgiveness on that is going to be streamlined. So that's good for our bankers. It's good for our businesses, and that's great news. Thank you very much. We did have two questions. One, I think Emma can help us with, or Lexi. One is, who is our local SCORE representative? I know we have Rod Clark and Peter Godfrey, and they're accessible either by phone or by the internet, email. And so I'm going to ask Emma or Lexi to go ahead and post their contact. Wow, that was fast. Information down below. So that's fantastic. So whoever had asked that question. And then another one was, it looked like someone had applied for a grant to assist veterans in the city, in the region. And there was funds through, I guess, the federal government or SBA. And they were wondering if there was any technical assistance available from you, or whether you could direct them to maybe Susan or someone else to go over the application and figure out what they need to do to adjust it to get the help for the veterans in our area.
So I did see the question on the Q&A. I believe it is a loan that they're referencing, is not a grant, because again, grants are much easier than loans to get. So I think the question was in reference to credit enhancement from the SBA on the loan request. And from what I could see on the question asked, I believe they are a nonprofit. So the only program that, we have available that's, or had, I should say, was the PPP loan that we could work with nonprofits. So on the traditional SBA loan products, the 7A, the 504, the microloan program, we do not work with nonprofits, but our counseling services would be available. So SCORE, the SBDC and the Center for Women in Enterprise, along with a Veteran Business Outreach Center, would be by far the best course of action at this point for them to strengthen their application and work with a technical assistance provider.
Okay. Thank you for that. And if there's a follow-up question on that, please just post it and we'll see if we can help out. Yeah, he's saying it's not, or he or she is saying it's not a loan. So,
okay. So we can certainly follow up. I'll put my contact info in here and we can connect directly.
Okay, great. Thanks so much, Eli. Appreciate that. Also wanted to mention Dennis Carmen. In these times, the United Way is a huge asset to our folks in the region, employees, employers, landlords, what have you. There's a lot of folks in need right now. The United Way funds almost every agency that assists people. So Dennis has been on these calls regularly over the last 28 weeks, and every now and then you see a very positive comment from him because he's a very positive individual. But he's helping a lot of people. And if your company or your organization can think of the United Way and help them in some way, please do so. All right, I'm going to now jump. Thank you, Eli. I appreciate that. And hopefully next time we'll be hearing about a stimulus round. I know I'm laughing because we've been talking about this since August 1st. So, but they got to do something, and we know that. But it's just we want to.
Fingers crossed, Chris. Fingers crossed. We desperately need it.
I'm right there with you. So we're delighted to have with us Lisa Field. Lisa is a nurse. Everybody wants to know a nurse right now, right? Just in case you need it. And she does legislative outreach for the Massachusetts Nurse Association, but she also serves as co-chair of a committee appointed by the mayor involving health equity and employee and employer mitigation in terms of working out what's best in these days of COVID and how to handle and how to encourage employees to be honest about whether they're sick or having symptoms, and encourage employers to understand what their obligations are while also availing themselves to benefits from the federal government that will help offset some of the costs of allowing employees to stay home. So without further ado, Lisa, a great session yesterday. I know you had quite a few people on that call, And again, we're going to post that as a resource for our members. And happy to have you with us today. Can you tell us a little bit about you and the program and all of that?
Absolutely. Thank you for having me on. So several months ago when all this started, it was just several months ago, it feels like one long day, the mayor pulled together a health equity task force. So who's on it is local elected officials, including city councilors, as well as nonprofit organizations, labor unions, that's where I come in, as well as healthcare professionals. You kind of name it, they're kind of on this health equity task force. And part of the whole, right now, we're working on COVID response. So the plan was to pull everybody to the table, have people brainstorm as to where are their gaps, make sure, one, we're all on the same page as to what resources are out there, and then how to get the information about resources out. Brockton keeps going in and out of the red zone, so to speak. We've had enormous loss of life, enormous cases here in the city. So how can we prevent the disease from spreading, as well as how to keep people safe? We want businesses to not only open safely, but be sustainable and remain open. So what we did is we pulled together everyone together, and then we divided up the work into different subcommittees. So we have one working on RAFT, the rental assistance. We have another one working on small business initiatives. We have a third working on educational equity. As you know, there's a whole issue around online learning and internet access and learning pods and making sure children have masks, that when they end up going to school, whether it's hybrid or full-time, that they're properly prepared with the equipment that they need and not bringing home things to their families. And then the fourth one has to do with worker safety. So I just want to say one more little thing before I get into the worker safety. And that's a real positive thing about having kind of so many players to the table, is that when programs come up for advocacy, like additional funding for RAFT, we're all kind of at the table. We can go back to our individual organizations, so not to be able to advocate. So not only do we advocate as a health equity task force on behalf of Brockton, but also we go back to our individual organizations. I come from the Mass Nurses Association. I sit on a lot of central labor councils, so the Mass AFL-CIO. So I bring all this material back to say, here are the programs, here is what the need is, and then we all kind of write letters and advocate. So it's a way to be all on the same page for the common good, so to speak, because that's what we want. Everyone to be healthy, and we want business to be sustainable. We want customers and workers to be healthy as well, and kind of get back to life as normal as quickly as we can. So on the Worker Safety Initiative, we were very fortunate to pull in an organization called MassCosh. They're an occupational health and safety nonprofit. They're funded through grants as well as through labor unions. They provide training, they provide resources, and they also have a retired epidemiologist from the Massachusetts Department of Public Health on their board as a volunteer. She's been volunteering here on our Health Equity Task Force, working with Dr. Herman, as well as the Brockton Board of Health. Invaluable research. It's really invaluable research, as well as invaluable contacts. So part of what the Worker Safety Initiative wants to do is that we want to make sure that your employees, your customers are safe, that you're able to open safely and stay open safely, that you know the resources that you have to be able to do that. And then we also want to make sure that we're providing support to the Department of Public Health. The bottom line is that if a customer or a worker feels that something is unsafe at a business or workplace or school, they can contact either a hotline through the Attorney General's office to make a complaint, as well as to the governor's office. But both places, the AG as well as the governor, send all that information to the local Board of Health. And you can imagine that I don't think there's any municipality here in the Commonwealth that actually has the resources locally in order to be able to kind of deal with all of this. So one thing we were able to do is we were able to partner with the Boston University School of Law, and we were able to get some students to come in and to be able to provide some support to the local Board of Health and kind of getting in data, providing a platform to be able to kind of deal with all of these type of issues. If people have questions, if people have complaints. So we're in the process of working through that with the Board of Health. The second big thing that we did was this roundtable yesterday that Chris was a part of. And we provided an hour-long worth of resources and training what we want to do is have this initial roundtable to be kind of the first step in that, to bring businesses to the table, to be able to say, here's some best practice, here's what the state guidelines are, here's some best practices, and then here are also some resources for you. Here are some obligations that employers have under the law. Here's some what we want workers to be able to do, we want them to disclose whether or not they're sick, to stay home and not come in and infect customers or each other. And then also we want to be able to have a dialogue so that if there are resources that are needed or there are obstacles to be able to do all of this, that we can help through the Health Equity Task Force to find those resources, to connect those resources. We have translation services available, so we've been trying to do a lot of the material, not only in English, but also Spanish, Cape Verdean Creole, as well as Haitian Creole. Again, because of the organizations that are at the table, we have access to be able to go out and try to find some grants to be able to help in this work, not only nonprofits, but also the task force. Again, I work for the Mass Nurses Association. My organization has offered our print shop up to be able to print up material for the Health Equity Task Force to be able to distribute all of this. So we did record the roundtable yesterday. We're currently today working on gathering some input. People have been emailing us input. We're putting together a fact sheet as well as copy of the slides, copy of the recording, some other resources, and we plan on sending that out early next week. So we will send that out to Chris so he can be able to put that right up on the Chamber's website. We're also looking for next steps. We're able to provide training through MassCosh, kind of what do employers need. We can do it specifically according to the sector. We're just really here as a resource, and we want to be a partner because we're all in this together and we all want to come together as a community to move forward. So that's my spiel.
Thank you for your leadership, Lisa. I mean, it's just terrific what you're doing professionally and also personally as a volunteer on this task force. So thank you. You know, you and I were talking candidly a couple of days ago about what employers are facing and employees are facing. And so we talked about with each side, and I want to kind of get into that a little bit with you now. Employees are being asked by employers to fill out sheets every day, questionnaires, kind of indicating whether they have a symptom or they've been in contact with the symptom. And employers are telling me that in some cases, employees may be asymptomatic and they're not answering the surveys honestly. And that's resulting in infections of customers and other employees. And when questioned, the sense is that there's fear that they're going to lose work time and wages, while maybe somebody else in the household's already been laid off. And so, and then on the flip side, some employers, when asked by an employee, gee, I have a symptom and I want to stay home, they may tell them not to come back, and not realizing that the CARES Act kind of addresses that. Can you talk a little bit about both those scenarios and what's being done to try to get people to an honest factor so that we can kind of get through this and not continue to spread this virus?
Talked about in the roundtable yesterday, some of the best practices are to do a checklist to make sure and question employees as they come in. I'll use an example. I have a little loved one that goes to daycare, and every day her temperature's taken and we're asked a whole series of questions. We have to, and everybody trusts that we're going to answer honestly. We need to. That's kind of the deal. So it's perfectly acceptable best practices to have. We give some suggestions on what questions to ask. Again, we're happy to send out that slideshow and presentation early next week. But ask, have you been in contact with anyone within the last however many days? There's a whole series of questions to ask. On the flip side, as to why employees would answer honestly, I think part of it from an employer point of view is to be quite honest and really encourage. How do you encourage your employees to answer honestly? The Commonwealth has given out posters to put up as to here's kind of what your benefits are under the law, and really encourage people. Paid sick time, I know that's difficult. There is some provisions under the CARES Act for some reimbursement over that. Again, we can send that out in the slides, where to go to find out more information and what the tiers are, who's eligible, who's not. But again, that kind of addresses part of that. If they're afraid to stay home because they're not going to have any money to pay the rent, and the business is eligible under the CARES Act to be able to provide paid sick time, employers need to encourage that. So again, I think it's really open, honest dialogue to really make sure and encourage that. From our point of view, that's why we're trying to get out this message in many different languages to answer honestly. Here are the resources if you need the resources on what to do. I hope that helps.
It is. It is. Well, I know you had a speaker on yesterday who got into it and detailed each of the what do you call it, tiers of reimbursement. And that was fascinating to me because I have not heard that talked about in terms of solution. In other words, okay, you're not feeling well, stay home. We will pay you. And now talk to our bookkeeper, talk to our controller, because I think it's for 50 employees, employers of 50 or more. They can now easily access that credit, that tax credit, take it right off the taxes for those wages up to a point, depending on the tier and depending on a few different variables. But she did a very good job of describing it. And maybe we should grab that clip off of and just post it and get it out to all of we've had over more than 850 people tune into these Friday calls. So maybe we can, do a shortened clip of that and send it around, because we really want to spread the word that employers also want to be encouraged to tell people to stay home and to pay them and to get reimbursed by the federal government through the CARES Act. So a lot of CARES Act money out there that is still in play, that is still accessible, that folks may have only focused on EIDL or PPP or things that have expired or waiting for renewal. But there's other pieces that are out there like this provision to allow employers to be reimbursed for sick time and time that employees have to get out, stay home to prevent the spread of COVID. So that's terrific. So we'll do a little research on that, and I know that link is coming to us, so we'll get that out there to everybody as well. Anything else you want to add, or any other resources you want to talk about or post?
Just again, we want to be a partner in all of this. So I know when people hear Mass Nurses Association, labor union, we're all in this together, and there are a lot of partners on this task force. So we just really want to partner to be able to get through all of this. So I'm happy to send everything over to Chris, and we can get that up on the link. I'm going to put my information in the chat. By all means, if you have any questions, or if you want to make sure you're kind of in on the email string, or you have any suggestions when it comes to your particular type of business, we're happy to bring that back to the Health Equity Task Force and figure out how we can help you. So again, I really appreciate having the opportunity to come on.
Thank you, Lisa. Thanks for being with us. So I'll just wrap up by reminding people the Secretary of Labor, Rosalind Acosta, is going to be with us on Tuesday, the 20th. That's this coming Tuesday at 12:15. We hope you will join us for that call and hear firsthand about the new budget and what's in there, what's in the budget for the Division of Labor and Economic Development and that type of thing. I also want to remind you that the annual meeting for the Chamber is coming up on November 18th. We have more than 250 people already registered. It's not happening live. The exec board met last week. It's going to be a virtual event. And many companies have already stepped forward and said, please donate our meals to nurses and to doctors and to first responders. So we will be delivering those meals that day while we're holding our annual meeting, and they'll be delivered to the various facilities in the area, compliments of those companies that have signed on. So we encourage you to sign on if you haven't, and hear a great speaker. Our speaker is the race director for the Boston Marathon, and Dave McGilvery, and he's been the director there for 35 years, but he also has a really inspirational personal story, and he does national speaking and has come highly recommended, and I think it's time well spent. We'll be about an hour. We'll also recognize some companies that have invested more than $1 million the last 12 months, and also acknowledge some board members who will be going off the board and some new board members who will be coming on to the board of directors. So again, that's the 18th. In all the weeks in between, every week we have virtual networking. It's great to see people come on for the first time and meet other people and go, oh, I've been shut up in my house for so long. And it's great to be able to, spend an hour just kind of hearing from other people and answering a funny question and just, maybe picking up a customer or a client or two. And so please stay tuned for that and register for that through Lexi. Let me just check our chat and our Q&A just to make sure we've addressed everything. Any affiliates marketing link to apply for a loan. Looks like we have someone looking for marketing link to apply for a loan. So I think that's from Jean Bernardo. Jean, maybe you can contact us, the chamber, and we can put you. We're all awaiting this next round of loans from the SBA, but Seed Corporation offers loans, and as do many of our banks, and we can put you in contact. Forgive me, Eli. The EIDL, is that still available, or is that?
It is, Chris. It
Okay.
is available, and there is still funding left. So if we are, believe it or not, we're seeing folks who didn't think this was going to last this long, just reach out now and say, hey, is that funding still available? So it's capped at $150,000, but there is funding available, and it's a much shorter wait period now. So we're seeing loans get approved in 3 to 4 weeks.
So, Gene, I would recommend that. It would also put you in the queue when this next round of PPP, I believe, is going to come around. So that's the EIDL. That's emergency. What does that stand for? Emergency
Economic Injury Disaster Loan.
Okay. So there you go.
I'll put the link on the chat.
All right, great, perfect. So, Gene, I would encourage you to apply for that online and see if you can access some of those funds. This is a perfect time to do it because it's a little bit quiet in between rounds of stimulus. And so that's great information, Eli. And a great question, Gene. Thanks for asking that. Any other questions I'm missing? I sometimes have a hard time scrolling down to all these questions because of my computer. Thank you, Emma and Lexi. You've really posted some great information on here as well. We have Lisa Field's contact information if you want to follow up with her. And I see Jay Patakis is listed from Mass Development, who's willing to talk with you at any point. And Eli just posted his information. So, Gene, I would definitely recommend the EIDL. And you've got the link there, and call me or us if you have any questions, and we're happy to follow up with you on that. So I think that does it for this week. We are planning on being back here 2 weeks from today, and hopefully we will have a stimulus to talk about. If not, we will have more great information for you because a lot is happening. And so hope you have a nice weekend. I want to thank all of our panelists for being with us, and all of our folks who tuned in. Have a great day.
Thank you, Chris.